You're listening to the Mother to Baby podcast, medications and more during pregnancy and breastfeeding. Ask the experts with your host, genetic counselor and mom of three, Chris Stallman.
Welcome, everyone, to another episode of the Mother to Baby podcast. My name is Chris Stallman, and just in case you're new or need a reminder, I am a genetic counselor, a teratogen information specialist, as well as a mom of three. Teratogen information is just information about exposures that happen during pregnancy. We also talk about exposures that can happen during breastfeeding or before you're pregnant, or if you're considering adoption. And an exposure can be anything. It could be a medication that you take. It could be if you're hanging around a particularly sniffly or sick coworker. It could also be things like hair dye or nail polish. So that gives us a lot to talk about and a lot of different questions that we get asked. Today's episode is going to focus on two very specific exposures. So we're going to be talking about the use of alcohol during pregnancy, and we're also going to be talking about the use of opioids, or a type of pain medication, in pregnancy as well. And we have the perfect expert with us today. So today on the show, we have Dr. Sarah Obachan, who has a very extensive and really interesting biography. So she's an assistant professor of obstetrics and gynecology in the Division of Maternal Fetal Medicine at the University of South Florida. A doctor who practices in obstetrics and gynecology is someone who takes care of women, both before, during, and after pregnancy. Dr. Obachan completed her degree in psychobiology and also has a minor in chemistry and religious studies from the University of Miami. So she has a lot of different type of experience. She is a member of the Society of Maternal Fetal Medicine. She is a member of the She is a fellow of the American College of Obstetricians and Gynecologists. So that's the group that's called ACOG. And she is a member of the Society for Birth Defects Research and Prevention, which is formerly known as the Teratology Society. So we are very grateful to have Dr. Obachan. And if I may, Dr. Obachan, may I call you Sarah?
Absolutely.
Excellent. So just to wrap that up, thank you so much for being here today. We have some great questions, but first and foremost, I wanted to welcome you. Thank you. Thank you for being here. And then also mention that, if I'm not mistaken, you are the mother of two small boys. Is that right?
Yes, I have two small boys, a 6-year-old and an almost 3-year-old, really ruling my life.
Wow. I was going to say, you are an exceptionally busy lady. So thanks so much for making the time.
Thank you. My pleasure.
Okay. And Sarah, before we talk to you a little bit more, we're actually going to hear from our listeners. So on the phone now, we have Mary, a caller who has some questions about the use of alcohol and opioids during pregnancy. But interestingly, it was not a pregnancy that Mary had. Mary has a question related to the adoption of a child that she is considering. Mary, are you with us?
I am. Thank you.
Hi, Mary. Nice to speak to you. Thanks for calling in today.
Oh, you're welcome. I'm glad I got through.
Oh, awesome. Where are you located?
I am in Connecticut. My husband and I, we are both from Connecticut.
Okay. And so, Mary, what question do you have for us today?
Well, I probably have several different questions. We are looking to adopt a little 8-year-old girl, and we have gotten some background information about her, and we have recently learned that we weren't exactly correct in some of the information that we believed about alcohol as well as opioids. So our question really is, we know that the mom has used a lot of opioids, but at time, through some background information we learned about the mom, through some information sort of on and off about alcohol abuse a bit, or we're not really quite sure how much alcohol, but it's been brought to our attention that her alcohol use is something that's more significant than the opioid. So we're really confused about what is passed on to a child and what we should be looking for, or it's just sort of very overwhelming when you're talking about the opioids and the alcohol together.
Absolutely.
So if you could address that, that would certainly help us, because it's definitely a big topic.
I agree. And I do think it's something that people have a lot of questions about because, of course, there is a lot of information out there about the use of opioids, the opioid epidemic, the potential for what could happen in a pregnancy. And, you know, it's sort of in the forefront right now. Whereas alcohol is something we've known about for quite a long time, but right now it doesn't have the same media presence as opioids do. So I can see how it gets really confusing really quickly. And luckily, we do have an expert here today who can help address those questions. So, Sarah, what would you say to Mary about her question?
So hi, Mary. Congratulations again on your decision to adopt. It's such an exciting time, but I also know a confusing time for specifically my patients. And yeah, you're right. I mean, opioids, for lack of a better word, have been kind of ignored, and finally this epidemic is getting some light and some more medical attention, and even more importantly, I think some psychosocial attention in our communities. So you're right, the effects of alcohol have also been known for a really long time, but unfortunately some of these things are an issue because um, it's hard for us, even as physicians and clinicians and healthcare, providers, is to actually define what the problem is, what fetal alcohol syndrome really is, and what are some of the criteria that the children will meet if they're really affected by this. And some of the issues for that is that also it's hard to not only find that physical abnormality, which may not be visible in the beginning of life, but then also those neurodevelopmental, those cognitive things as how the child develops may not be shown early in the time the baby is born. In reality, everything crosses the placenta, so everything is passed down to the baby. It's just a matter of how much it can actually affect that baby. So some children don't really have strictly recognizable physical features that will be specific to fetal alcohol syndrome. Some of that might be cognitive and how we develop with our behavior, and even, for example, hyperactivity issues. And there's really no amount of alcohol that we can use that is completely harmless. There's no kind of low level that is acceptable in pregnancy. And that may be because as women, as people, we all metabolize alcohol differently, and how that can affect our children maybe in a different way. So we do understand that large amount of alcohol, so intake that's really high or binge drinking type of behavior, puts our children at a higher risk of developing fetal alcohol syndrome. Children who are exposed with alcohol do have to be evaluated closely for any signs and symptoms early after they are born, and there's different ways to do that. But certainly early therapies and early evaluations can really help us to give these children kind of the best they need during their development.
And Sarah, you mentioned something interesting. You mentioned the features of fetal alcohol syndrome. Would you be able to tell us a little bit more about that?
Yes, absolutely. So when I talk about features, some of that is basically physical in nature. In other words, things that we may be able to see on a child. If their faces might have features that are specific to fetal alcohol, they may actually grow differently. So they may grow smaller, either in utero when the woman is pregnant, or even after when the babies are born. They're just maybe smaller and not meeting their growth potential. They may have some small ear deformities and sometimes a small head size. They also, even though we wouldn't see this physically by just looking at the children, they may have a heart defect. So often these children have to be evaluated by a pediatric cardiologist, or if we know the exposure is happening during the time of pregnancy, we'd like to do something called the fetal echocardiogram, which is an ultrasound looking specifically at the baby's heart for their development. The other features are more, again, cognitive in nature. They're more kind of psychosocial, so behavioral issues and hyperactivity that we spoke about.
And Sarah, I know that one of the things that you do focus on are some fetal interventions and things like ultrasound. So that fetal echocardiogram that you talked about, the ultrasound of the heart, can that be performed during pregnancy as well?
Yes, absolutely. The fetal echocardiogram is performed during the pregnancy. the best time to look at the heart is between 18 and 22 weeks of pregnancy, so right in the middle of the pregnancy. You can see the heart very well, and the heart is essentially completely developed in terms of its anatomy, and you can see some of those features if they are abnormal. If those things are not done, or for example, in a case like this, so we haven't recognized the fact that mom has been exposed to alcohol during the time of pregnancy, we can do an echocardiogram, a neonatal echocardiogram, meaning on the baby itself after the baby is born.
Really interesting information. And Sarah, I know, of course, you're a physician and get a lot of questions anyway, but what our listeners may also not know is that you also have opened the MotherToBaby Florida affiliate. So a service specifically that talks about this type of things. And it seems like, with your experience, it would be something where people would be seeking you out to ask these type of questions. Do you find that the type of question that Mary had so far is one of the ones that you commonly get?
Yes, we do. We do get a lot of exposures in pregnancies. We are lucky enough to have our own physical clinic here where we see patients in the clinic and can see them face to face, but we're also able to answer questions over email and over phone lines as well if somebody has a question within our state. But those questions are very similar to what we get in our clinics, and we have a program in which we follow them and do an echocardiogram in the time of pregnancy, looking at that heart specifically, but also follow these babies to look how their growth is going on.
Excellent. That's really interesting. And I know Mary is on the line and she does have some additional questions. So we're going to take another one from her right now.
Are there any behavioral things that are passed on to a child from a mother that would be coming from an opioid, opioids as opposed to alcohol? Like, there are different behaviors that you would see that we've been told about. Like, opioids, as we've been told, aren't as significant as alcohol. Like, we should be more concerned about alcohol than we are about the opioids the mom used. So, and we're trying to understand why. Like why is alcohol for a baby worse than opioids?
Again, a really good question, because it doesn't seem sensical, again, in the way that the information is presented to us as the general population as a whole. And I know that Sarah's going to be able to address that with you. But what I want to add in is that we think about exposures, of course, but then we also think, depending on the exposure, what is the underlying reason for the exposure? And so sometimes you have instances where a pregnant woman has a mental health issue that is not well controlled, and so they decide to self-medicate. So certainly Sarah can speak to the behavioral issues surrounding alcohol in pregnancy, but also just to sort of throw out there that there may be behavioral issues or learning disabilities or other things related not to the exposure itself, but for the reason that mom is having the exposure. So untreated mental illness, any other kinds of issues related to that. So that's what makes it such a mixed bag.
It's not my area of expertise, but as a mom of two boys, I am always completely fascinated in how they're developing and growing. And really, when you think about it, there's so much that goes into behavior. Some of it is genetic in terms of there may be a genetic underlying true component that's there that actually influences how we behave. But there's also the psychosocial component, how we grow up and what environment we grow up, and what our mothers or our caretakers are exposed to and how they are. So that all influences our behavior, and unfortunately it's not kind of a linear, this causes that. It's a combination of things that makes us who we are. So yes, those things are passed down from mom to child, but in which capacity is it genetic or kind of situational, behavioral, may have different influence on that. In terms of why alcohol is really considered to be more, more difficult or harder on patients, is that we understand that alcohol exposure, especially heavy alcohol exposures, can cause physical deformities in a child, especially in that early trimester, as well as some of the neurocognitive issues that develop throughout the pregnancy and after the delivery. With opioids, there's less of a impact in terms of real physical deformities, and I won't say it's never going to come to light, but it's just less visible in the literature and in our clinical population. What we worry about in opioids is that we have children who are born with neonatal abstinence, and so they have to be taken care of. Sometimes in a neonatology unit, they need some more attention in terms of their thermal regulation, their temperature regulation, and how they're taken care of. But usually, once that goes away, they're doing relatively well after the first couple of weeks, and we don't see some of those neurocognitive issues until much later in life. So there's this appreciation that alcohol can cause more of a physical deformity in addition to the neurocognitive deformities.
And Sarah, I think that's a good point mentioning the first trimester of pregnancy, and why that's important because, as many people do know, and of course many people don't, that approximately 50%, so half of all the pregnancies in the US are unplanned. So a lot of times women can have an exposure like alcohol for various reasons. So, you went out to celebrate, it was your birthday, it was a holiday, and they don't know that they are having alcohol at a time when they're also pregnant, because you don't instantly know that you're pregnant. So when you have that exposure in the first trimester and, the organs are forming in the pregnancy at that time, is that why it can be especially risky to have that exposure in the first trimester?
Yes, that's a very good question. I agree. I think we need to put more emphasis on prenatal care. In other words, really even preconception care, if you will. In other words, prior to the woman becoming pregnant. You're absolutely right. More than 50% of pregnancies are unplanned in this country. And alcohol is a part of our society. We do use alcohol, even in really small quantities in moderation, to celebrate things, big events and girls' night out and, any kind of success or celebration. We have that as a part of it. And if we don't know that we're getting pregnant and we don't have those early signs of pregnancy or not expecting a pregnancy, we may not know that we are being exposed to something like this. So it is important, I think, to always mention that if we are planning a pregnancy or there could even be a potential for a pregnancy, to use a prenatal vitamin. A prenatal vitamin really is only a vitamin that's helpful for women in general. And obviously to use an appropriate contraception if a pregnancy is not desired. And then during the time of attempting a pregnancy is to really be careful in terms of the amount of alcohol that we're using and really avoid behaviors that could put us at higher risk, such as binge drinking, taking our tests early so that we know that we are pregnant earlier than later, and then seeking out care with your obstetrician as soon as that you realize you're pregnant.
So Sarah, talk to me about binge drinking. What exactly is that? I know that it's very hard to define and you can see different things in different places, but what do you consider, or what is the standard consideration for binge drinking?
That's a great question. So in terms of binge drinking, I agree. I can't really find a very good, apt definition of how many drinks it is. But when I speak to patients, I kind of want to get a sense, and in a non-judgmental way, exactly how much alcohol they're using. And it's difficult because women have a lot of stigma in terms of alcohol, and they don't want to tell you because they think they will be judged in some capacity. I want to ask them if they can tell me how often they use it, how much, and they can maybe show me, how big is their glass of, wine, or what type of alcohol they use, so I can estimate the true content of alcohol that's there. But when I hear I really don't drink a lot, but every probably 2-3 weeks I go out and I drink a amount. And how much is that? Well, it's, maybe like 6-7 drinks, and I tend to pass out or just not really remember some things from the night before. I mean, those things are really, any one of those things can be a red flag to me in terms of, I have to identify this as a potential problem and watch them more carefully. And I hope to do that really in, like I said, a non-judgmental way, where I can explain to them I completely understand that here's what we should be doing from now on, and here's kind of the regimen that I think we should use to take care of you and your baby during the time of your pregnancy.
And I think that that's such a critical thing. I mean, I know as healthcare providers really do try to be non-judgmental, but it is hard, I mean, you do establish trust with patient, absolutely, but it's still a really scary thing to say, well, I've had this amount, or, whether it was something they didn't intentionally do, or if they have, an addiction issue and it's very hard for them to cope without, alcohol specifically, it can be really hard to do. So it is appreciated, and just know that we are thinking about it as providers, the best way to get the information to help you, but also to do it in a way that's gentle and non-judgmental. So I appreciate that, and I'm sure your patients do too.
Oh, very nice. Thank you.
Okay, well, that was a whole lot. So I think that this is going to be a good place to stop. However, I know that Mary, our caller on the phone, has a lot more questions, and I know that I have a lot more questions for Dr. Obachan. So we are going to stop now. However, we are going to be back. So the next episode is going to focus still on alcohol and opioid use during pregnancy, but talking about things like, okay, we know an exposure has occurred. Are there recommendations? Are there things that we can do? Are there special things that a child would need? So Sarah, thank you again for being with us today. We really do appreciate your expertise, and I would like to formally invite you back next time to finish answering Mary's questions. Would that be okay?
Yes, absolutely. Thank you for having me.
Oh, our pleasure. Okay, and for you listeners, thank you again for joining us today. We really hope you're going to join us again next time. It's going to be a really interesting and informative session. But just so you know, if you have a burning question that cannot wait, if you want to be part of our podcast, or if you just want to learn more about our organization, I encourage you to contact MotherToBaby. And as always, there are several ways to do that. So you can always find us online at MotherToBaby, all one word, .org. You can call us toll free at 866-626-6847. You can also text us at 855-999-3525. And on our website, you will find all that contact information, all of our information, and more, including fact sheets that we have about exposures, a way to chat with a specialist if you want. We have a lot to offer at MotherToBaby, so please feel free to contact us at any time. And as a reminder, as always, MotherToBaby is a nonprofit organization, so all of these services are at no cost to you. And signing off, this is Chris Stallman. Again, thanks so much for joining us today. We hope that you will subscribe to our podcast and never miss an episode. You can find us, of course, on Spotify, iTunes, or any place that you like to get your podcast. And remember, MotherToBaby is here for you. Take care.
MotherToBaby is a service of the nonprofit organization of Teratology Information Specialists and supported by the Health Resources and Services Administration of the U.S. Department of Health and Human Services. It's made possible through generous donations from listeners like you. To learn more about MotherToBaby, please visit mothertobaby.org.